it's GGC News. We're here today with Thomas. Thomas was born in 1996 with a rare condition known as bladder extrophy. Thomas, can you tell us a little more about your story?
But of course, Marie. I was born with bladder extrophy.
Face the camera.
I was born with bladder extrophy, and it's basically a condition where part of your bladder is outside your body when you're born. And I've undergone a surgery for 12 hours to repair it, and I've undergone other surgeries to make it bigger since. And I've also gone a surgery related to a sports accident that I had when I was playing sports at school. And this is not funny, and I want to be a counselor when I grow up.
And now we're here with Dr. Michael Mitchell. Dr. Mitchell actually worked with Thomas when he was an infant and helped to repair his bladder through numerous surgeries. Dr. Mitchell, can you tell us a bit more about bladder extrophy?
Sure. Thank you, Marie. I can remember about Thomas. He has bladder extrophy, and it was one of the rare cases I treated. And then the situation is bladder actually did not really grow fully. So, and as well as the abdominal wall. So when the baby is born, the bladder is like turned inside out, as well as outside of the body. So I mean, in that case, and we don't even know actually what caused it. So it's like it can just happen out of the blue moon, but it's not. It's something that doesn't actually always happen like that. So I mean, in that case, when we saw that with Thomas, what we actually did is within 48 hours, we have to do the surgery, because that is like the life of the baby actually depends on it, because the baby cannot pee, cannot do anything, and the baby is prone to infection and stuff like that. So I mean, I wish I could tell you that there is a way we can prevent that, but there is no way we can prevent it. But there are some things that comes with the surgery. After the surgery is done, we have to make sure the baby doesn't have any form of UTI, any form of infections. Kidney infections and stuff like that. So with that, and the surgery that was done on the baby the first time, it's like that's just the first thing. And as the bladder is growing, we have to keep doing more surgery in order to be able to, get this thing done. And once this bladder is getting larger, we have to do another surgery to actually accommodate the bladder. So that is what happens. And also, there is no test for us to know. There is no lab test to know that maybe this is happening or this is going on. But with prenatal early imaging, we can easily know if the baby is having that problem, and we will be prepared for it once the baby is born in order to get the surgery done. And we can also know through diagnosis tests like fetal ultrasound and MRI. And there are a lot of stuff that we have to do, and there's a lot of professionals that are involved in this, because it's not only the surgeon, and also the nurses have to make sure they have to know how to take care of the baby. Okay, we have the nurses that have to make sure that the baby is actually laid supine, and they have to make sure that when they're changing the baby's diaper, it doesn't affect the surgical part. And also, we need to find about the nephrologist that's going to help us know much about the kidney and know how the kidneys function, as well as the bladder. And also, we need the dietitian to know the right food for the baby, especially for good nutrition. And also, the big thing we look for during those periods of surgery is infection. We don't want to get the baby infected or to have any problem with urinary incontinence. So baby might not be able to control bladder and stuff like that, even despite after it will be older. So those are the things we have to watch for during those periods of surgery. And this actually explained everything we did with Thomas, and we make sure we actually control his pain also, because with surgeries like that, there's a lot of pain that are actually involved. But we try to make everything, and I'm really happy that Thomas is doing well and is fine right now.
All right, thank you so much.